It's really great to have you all with us again. Just to open today, I'm joining you from Canberra on the lands of the Ngunnawal and the Ngambri people. I want to acknowledge those traditional custodians of this land and pay my respects to elders past, present and emerging, to extend that same respect to any Aboriginal and Torres Strait Islander people who are joining us today. A few quick housekeeping notes straight up. So if you have any connection issues during the session, there are dial-in details on screen. They're also in your meeting invite. Use those if you need to. As usual, today's webinar is recorded. We'll upload the recording to our website so you can watch it again later or share it with anyone who wasn't able to join us today. You can also watch any of our previous webinars on that site, and that'll keep you going for quite a while, given I think we're at webinar 31 today. So that could keep you entertained for a long weekend. The links for the QR codes we show during today's session have already been posted in the chat. Feel free to copy those, any or all of the ones that are relevant to you, especially if you'd rather use the links rather than using QR codes on screen. We'll also email these links to you at the end of the week in our post-event email. Just be aware our chat function is turned off, but we do have the Q&A panel open for any questions. And while we're talking questions, the last 30 minutes of today's webinar is set aside for those very things. You'll find the Q&A tab at the top of your Teams window. Ask your questions using the Q&A tab at any time throughout today's webinar. We'll queue them up for the panel. Remember, you can also upvote other people's questions that catch your interest using the arrow below the question. And as always, if we get more questions than we have time to answer, we'll take them on notice. For any highly specific or detailed questions that are related to individual circumstances, we do encourage you to include your name so our team can get in contact with you after the event and work to get you an answer if needed. Or if you prefer, you can email us directly. The address is on screen now. Just use that one to get in touch with us. If we don't get to your question in session, please know you aren't being ignored. We do either come back to you individually. We also regularly use unanswered questions to come back at future events with popular questions. And we also use those questions and themes to plan agenda items for our future tech talks. So we're listening. We're interested in what you want to know. Please keep asking. Where needed, we do reach out to our policy colleagues for some questions, but generally speaking, just be aware our focus here at Tech Talk is on the technology and the delivery work. And so that's the area that we're most able to help you with. A quick note for any of our media representatives joining us today. First of all, welcome. We appreciate your continued interest in our transformation work. If you do have media related questions, please direct those to our media and events team. You can reach them at news@health.gov.au. They're best placed to help you through that formal channel. Great. Okay, so moving on, looking at our agenda first up for today. I'm not sure if our slides are moving with us. Thanks guys for kicking forward. Appreciate it. Okay, so on today's agenda, as always, we have Faye Fulvaris with us to start us off with the digital transformation update. Then we're joined by a couple of our professional friends from Aged Care Services and Sustainability branch and the Digital Reform branch. Rex Arnott will be presenting on the Business to Government B2G Client Management API co-design sessions that were held recently, and also some B2G release information, and he'll be supported by Annette as well. From there, we will come back with Shahara Pereira from the Digital Strategy and Assurance branch, who'll take us through the Government Provider Management System, the GPMS updates. And then we have Toby Burgess from the Digital Strategy and Assurance branch and Erica Barnett from the Assessment Home Care Transition branch, who'll be joining us to talk about updates in the support at home space, something that I know is a really popular subject for this audience. And then before we launch into Q&A, we'll have Emily Simlat from my branch, who'll take you through a quick learning bite. It's great to be welcoming all of our speakers back for today's webinar. I'll just double check that Faye has been able to join us. Emily?
Yes, I'm here.
Oh, hi, Faye.
Hi.
Welcome.
Thank
I'm going
you.
to hand over to you. For those that haven't met you before, Faye is our Chief Digital Information Officer here at the Department of Health, Disability and Ageing. She's responsible for driving the department's digital agenda, and it's over to Faye. Thanks so much.
Thank you, Janine, and welcome and a big hello to you all. Thanks for joining us. So first up, I'd like to start with our roadmap, and as always, it comes with my disclaimer. So we make a point of sharing this roadmap with you as early and as often as we can, and when changes occur, we aim to call them out here with you. But it should be noted that this is not to be considered an official commitment from government to deliver specific initiatives, scope or timelines. So final decisions are subject to cabinet and government decision-making processes. So normally I would spend time going through this roadmap, but that will be covered in detail in today's presentations by some of our other presenters. And instead, I'd like to highlight a major milestone for the digital transformation roadmap. So for the first time, you'll notice we've included the release on this roadmap of the Aged Care Quality and Safety Commission on our roadmap as well. So this addition was requested by you and is a great step towards giving the sector a more complete picture of the work being done across agencies. So that's with us in the department, across Services Australia, and the Aged Care Quality Safety Commission. So there are some exciting deliverables in there for the Commission, namely the one for late September, where they plan to release an API that allows providers to submit declarations of changes in associated providers. So that's great. It's part of paying down our staged implementation debt around automating things for you. And we are planning for the Commission to come to a future tech talk and walk you through their deliverables, and so stay tuned for that. Also some updates on the recently announced 26-27 budget. As you'd be aware, the budget is the mechanism where government funding is allocated to departments to fulfil the government's priorities. The latest budget includes a range of measures to continue supporting the introduction of the Aged Care Act for 2024, which started formally last November. And there are a number of outcomes that the department is seeking to deliver on. Firstly, in October, we will make necessary changes to remove the client contributions for personal care, that's kind of showering, under support at home, and the support, the new residential care capital subsidy payments ahead of 1st of January. So that's the first, in October. Then in February 2027, we are planning to enable providers to request a second period of end-of-life care under support at home, make the regular updates required to ensure accurate dollars to care reporting and publications for the FY 25-26 financial year, and work with Services Australia to commence digitising the hardship application form. And also in that time frame, we want to add the new residential care accommodation supplements for 20th of March. Also in these announcements is in July 2027, we will make refundable accommodation deposits, colloquially known as RADs, and the daily accommodation payment, which is the DAP changes, in line with the accommodation pricing review. And we'll work with Services Australia on residential aged care payments in arrears arrangements. Along with those changes, the budget will deliver $3.7 billion in new aged care investment, with $1.7 billion being set aside for new residential aged care beds and $1.4 billion for fair and affordable in-home care. Also, we'd like to, for all organisations out there around, register your SMS sender ID. This is a bit of a call out to let you know that SMS messaging to officially correspond from their organisation. So you might send something out, like you can see in the example here where it says AusPost, and you've got like this branded seller ID, sender ID. From the 1st of July 2026, there's new rules that take effect for branded sender IDs in SMS messages. So providers that send branded SMS messages with an organisation or service name as the header should be aware that they must register their SMS sender ID by the 30th of June. So you've got about 20 days left, folks, if they do not want their messages to be disrupted. Contact your telco or message provider as soon as possible to register your sender ID on the Australian Communications and Media Authority's Sender ID Register From the 1st of July, messages sent using a sender ID that is not registered will be labelled unverified on your recipient's phone. And they also appear as a single message rather than an ongoing message thread. So you might have like a chat thread from your organisation. So this is part of efforts to stop scammers using branded text messages to impersonate well-known businesses or brands. So for those who have a sender ID that they want branded, I would get onto that as soon as possible. Also, from an IACPA perspective, we've received questions about how the Independent Health and Aged Care Pricing Authority collects costing data for pricing determinations and how they can be involved to ensure their data is included. IACPA currently has an expression of interest open for organisations to get involved and supply some data. The EOI closes on the 30th of June, and so move fast on this if you want to be included. You can register via the QR codes on screen, and the link has been also posted to the chat. And IACPA has also just released support at home pricing advice for 26-27, and this pricing advice includes unit prices for services on the support at home service list. It also has a delineation of unit prices for care management into clinical and non-clinical care management, as well as separate combined price for team-based care management, which is assumed to be the same unit price as home care support care management. Information about the confidence intervals around the unit prices and the distribution of costs observed is also included, and the labour and non-labour and administrative components of the unit prices. So again, QR codes are on the screen, so feel free to have a look at those. Also, a couple more announcements. We also have in 2024, the department sent out our intent with an aged care data and digital strategy to support the major reforms that we've put up to at least 2029. It's not a set and forget strategy, and 1 year into the strategy, we've released 2 updates already. We are now in year 2 of the action plan that sets out what we're doing in the coming year. And the year 1 report shows our progress over the first year of the strategy. So it's a huge undertaking, and the reports and the action plan show you the depth and breadth of the work. So we just wanted to share that with you here, and you can access them through the QR codes. And finally, providers can now use Services Australia's Aged Care Provider Portal to manage more administrative functions for support at home, residential aged care and transition care. So these include submitting additional aged care forms, completing a wider range of tasks that are available to you. You can upload supporting evidence for late reporting of aged care recipient events. Sorry, I'm a bit tongue-tied today, folks. And uploading documents under the new category Document Lodgement authorised by Services Australia. And finally, you can also update your user contact details. So you can learn more about the new functions for the Aged Care Provider Portal that Services Australia offers on their website using the QR code on the screen. And for any technical support, you've got a number there as well. So that's all of the roadmap and announcements we have so far today. I'm now going to hand over to Annette and Rex. So I welcome you guys to give us a playback on the outcomes of your recent co-design workshops and give us a bit of an update on what's coming in our next release. So over to you both.
Thanks a lot, Faye, and hi, everybody. My name is Rex Arnott, and I'm the product owner for the business to government APIs. I was going to be joined by Annette today, but she's had some technical difficulties, so you'll have to bear with me with my non-dulcet tones for the duration of this presentation. So without further ado, I'll jump straight in. So today I'm going to take you through a bit of an update on the co-design session held in late March, as well as information on the new client APIs and what to expect in the upcoming end of June release. Next slide, please. I think we've... sorry, just back one slide, please. Yeah, thank you. So as you all know, B2G is an initiative responding to recommendation 109 from the Royal Commission into Aged Care Quality and Safety. The objective is to simplify how aged care providers share information with government by enabling secure system-to-system connections using APIs. So these APIs are designed to support provider operational systems, reduce manual data entry, duplication, and delays, as well as support providers' access to essential client information. By improving how provider systems connect, BDG helps staff spend less time on administrative tasks and more time delivering high quality care to older people. Next slide, please. At the last Tech Talks, we spoke to you a bit about the co-design sessions. So in late March, we ran a series of co-design sessions with aged care providers, software vendors, government and health representatives. The purpose of these sessions was to provide early visibility into the client management APIs, as well as their supporting tools ahead of their production release later in June this year. So we focused on how the APIs will be used post-referral acceptance and how they support real-world provider and vendor workflows. So we looked at both the technical design and the day-to-day business processes the APIs support to make sure that they're practical, usable, and valuable from day one. Thanks to everybody who took part in that. It was a truly valuable experience. Your feedback has directly informed the APIs moving to production in late June. So some of the key takeaways from the co-design sessions include that confidence is grown when a clear roadmap and scope is made available, and value can be demonstrated early, and worked examples and frequently asked questions are accessible. So the department has identified some immediate focus areas to address this feedback, including communicating API scope and timing early, sharing proven benefits of APIs, and ensuring that frequently asked questions and the conformance register is kept up to date. So in future, subject to funding and prioritization, the department will publish a roadmap to support planning activities, track adoption metrics, and publish case studies to share with the sector, and improve versioning, test data, and examples to assist with software vendors. Next slide, please. So today we wanted to provide you with an update on some of the time savings experienced. These are based on early results from a participating software vendor and provider partner. So for the residential care home, the current manual processes take them around 8 working days per month to collect and enter data. This includes tasks like skin checks, reviewing responsible person details, checking medication data, collecting allied health and assessment data. This means more time spent on administrative tasks, limits time available for care delivery. So in April, BDG had its first quality indicator submission via the API. The software vendor reported the API-enabled software reduced manual effort significantly. Pre-populated data processing time took approximately 3 minutes, achieved 83% of the submission fully automated, with the developer advising they expect this will improve as the system matures. The pre-filled data per submission to the department achieved over 98% accuracy. So ultimately, this means faster, more reliable submissions, reducing the manual workload for providers and an increase in data confidence, with more time spent on care delivery. So whilst these metrics present one submission, the software vendor is expanding to approximately 22 submissions in July. Next slide, please. So in addition to co-design, I'll give you a bit of an update on the successful release we had last week. So at the end of the week, last week, a bit scary Friday release, but we got it out smoothly. We delivered the final version of the client beta APIs and provided access to the final specifications for those final betas. So these final betas enabled developers to prepare for API testing and conformance in advance of the actual release scheduled for later this month. So between now and when those production APIs are released around June 29th, we'll only make changes to the APIs under exceptional circumstances. So off the back of the co-design sessions, we made some changes to the APIs, which are now reflected in the final betas. So these include an enhancement to the referral API to expose a subset of service referral data prior to referral acceptance. This means that you can now view service referral records prior to acceptance, supporting more informed and timely decision-making. So some of the key data fields that will be available pre-referral acceptance include issue date, service type, service subtype, referral comments, priority, due date, and a few more. So this allows providers to assess suitability, plan resourcing, and determine their ability to meet client needs before actually accepting a referral. It's important to note that the provider is still required to accept the referral in the service and support portal. Once accepted, the provider can leverage the full suite of client APIs to access more detailed client information, enabling deeper assessment, care planning, and service delivery preparation. So it's important to note that assessors are out of scope for the initial release of the client APIs, with a discovery piece underway at the moment to understand the full use case and how we might go about implementing the right solution for assessors. So in line with our standard practice, we released like I mentioned before, we've released the final client beta API suite to support developers in preparing for upcoming changes. Beta APIs allow developers to plan and prepare for upcoming updates before changes take effect, make sure software applications remain compliant, maintain operational continuity with minimal disruption, validate integrations early, and reduce implementation risk by avoiding last-minute changes. So by connecting systems more smoothly, these read-only APIs enable faster client onboarding, allowing access to essential client information to begin service planning, less manual data entry, reducing time spent copying information from my aged care into your system, more accurate and consistent information with fewer errors and duplicated details across platforms, and better support for care planning with the right information available to you at the right time. Overall, this supports smoother provider workflows and reduces the complexity around integration. Developers can access the beta APIs until they move into production in late June. Next slide, please. So this release also introduced updated conformance tiers. So another really important aspect of the business to government APIs. That includes 2 new tiers for B2G. The agency's conformance framework is structured in a way of making sure digital health systems are safe and secure. These support the goals of the Australian Digital Health Agency by focusing on quality, safety, and reliability. So the framework helps ensure that digital health software meets required standards through testing and validation, identifies and manages risks appropriately, keeps up to date with changes in systems and policy, and works well for other systems across Australia's digital health environment. So it brings together the safety, legal, operational, and technical checks to make sure digital health systems work reliably and, importantly, can be trusted. So each API that we're going to be releasing is aligned to a conformance tier based on the sensitivity of the data that it exposes. For B2G, this means the conformance model considers data sensitivity, the type of information being shared, and the level of risk associated with using the APIs through the B2G gateway, grouping software into 3 tiers based on the type of data being changed. So the first tier is foundational, and so that covers administrative data. Data is either combined or de-identified, so individuals cannot be identified, and has the lowest level of risk. Developers can actually now prepare for API testing against provider management v2 beta API to formally submit testing and conformance after the 29th of June when the production API is released. So it's important to note that now that those beta APIs are released, everyone can start preparing to submit for API testing and conformance, but you actually submit just after the final production APIs are released on the 29th of June. In terms of tier 2, the intermediate tier, so that covers data that's been de-identified but could still be potentially re-identified, carries a higher level of risk than tier 1 and must meet both tier 1 foundational and tier 2 requirements. The final tier, tier 3, which is advanced, that covers sensitive data, including personal or organizational identifiers, carries the highest level of risk, and requires the strongest security, privacy, and handling controls. So in order to satisfy tier 3, you have to obviously meet tier 1, tier 2, as well as tier 3. In simple terms, the higher the tier, the more sensitive the data and the stricter the requirements to keep it safe and secure. Next slide, please. So the release on June 5th provided access to those final beta APIs, like I mentioned before, which is scheduled to move to production in their final production version on the 29th of June. These APIs expose key referral and client information to support safer, more efficient onboarding and service planning, overall streamlining processes for providers and providing time-saving benefits. Prior to referral acceptance, only a limited subset of service referral data is available to give providers an initial view of service requirements. Additional client and supporting information is only accessible after the service referral has been accepted, ensuring appropriate access controls and data sharing. A reminder, like I mentioned before, that developers can now start preparing for API testing against Provider Management Beta API version 2.2, so that they can submit formally after the 29th of June release when the production APIs are released. The B2G team, as always, will be available to support software vendors throughout their API testing conformance journeys. Please feel free to shoot us an email, visit our portal and website for more information, and reach out with any questions. We value your ongoing engagement as we progress. And that's it from me. Thanks, everybody.
Thanks, Rex. It's super exciting. I remember when we sort of first conceptualized all of this, and here we are. We've actually put it out there. I know for some of you who are not providers and who want to access these APIs, we're not quite there yet. I know there's a bit of a task for us to figure out when we can give it to more groups of people, such as the assessors. So that's acknowledged, and we'll work on that. No promises yet on that one, but really now's the time for you providers to either speak to your software provider or your internal IT teams and say, can you connect us so that you can reduce your administrative overhead, because that's the way that you can pull the information back out. So well done to the team and everyone. All right, so now next up we've got Shahara, who's been with us before and who's giving us some updates on the government provider management system. So the floor is yours. Shahara, over to you.
Thanks, Faye. Today I'm going to provide an update on the next GPMS release and what providers can expect to see on the GPMS registered provider portal from the 29th of June. So this slide is going to show you an overview of the changes impacting providers, some of which I'll touch on in further detail in the coming slides, but I'll quickly run through these ones. So there's going to be added ability for providers to update some responsible person contact details, residential care home responsibilities, and further enhancements to the managing points of contacts directly through the Manage Your Organisation tile. There's also going to be updates to the quarterly financial reporting to support validation of reported residential care time delivery, and this will enable the department to monitor cost movements. The provider operations collections form is also being upgraded to include a GPMS DocuSign functionality, and that will enable providers to request and track signatures applying multi-factor authentication, correction, resend, and void envelopes. An envelope is a container used to send and manage documents for electronic signing in DocuSign. There's also going to be the ability for providers to switch between provider records within the same aged care organisation in GPMS, including records that have an expired or revoked status. As with all releases, there will be a system maintenance period to allow for these release activities, and that's currently scheduled for 10:15 p.m. on Thursday, the 25th of June, through to 8 a.m. on Monday, the 29th of June. These times are at the moment subject to change, but once they're confirmed, we will communicate the maintenance period to all users closer to the release date. Next slide, please. So as I mentioned previously, providers can expect to see upgrades to the way they manage their point of contacts and responsible person information in the Manage Your Organisation tile. So from the 29th of June, within the point of contacts, Personnel Details tab, providers with appropriate permission will now be able to notify of new or former legal changes. So that's for point of contacts. In the Manage Your Organisation tile, we'll also have enhancements to allow providers to update some responsible person contact details, including their phone numbers, email addresses, their availability, and any additional contact availability notes. Users with appropriate permissions will also be able to update responsible person residential care home responsibilities directly, reducing the need for the commission or department's assistance. And providers will also have the ability to individually bulk update or cease point of contact roles, reducing administrative burden. I will just add that while some changes can be made to the responsible person contact details in GPMS, Any updates that are affecting the responsible person's suitability must still be submitted via the responsible person updates form to the Commission's website. Next tile, please. Now, this slide shows the preview of what the changes will look like in GPMS. We've highlighted the bits that I'm going to talk about. So the new buttons that will be available for adding a responsible person to the residential care home, which is shown on the top left of this screen, adding a new or a former legal change shown on the top right of this screen, and bulk updating or ceasing point of contact roles shown at the bottom of this screen. It's important to note that these screens are not final and may subject to change closer to the release, but we do have GPMS user guidance material that are going to be updated and published on our website on the 29th of June, and those documents will have very clearly show you what the screens will look like. Next slide, please. Now, this is the Registered Provider Portal home screen. GPMS users with appropriate access can switch between provider records within the same aged care organisation, including those with expired or revoked status. Now, to do this, users select the new Switch Provider option from the top menu of the portal page, which opens the Switch Provider screen. This is shown on the left-hand side of this screen. From there, they choose a provider which they wish to view or manage and click Switch, which is shown on the right hand of this screen, after which they are logged into the provider record. Organisation administrators are responsible for managing access to provider records, and any records with an expired or revoked status are read-only and cannot be edited. Users who have access to this function will initially be logged on to their default account. And to ensure optimal performance when accessing GPMS, we advise that you use a single browser session at any given time. Next slide. Now, this is our GPMS comms and resources timeline. And you can see we've highlighted that there was a Yahoo article that was published on the 2nd of June, and there'll be another article published on the 16th of June informing providers of the upcoming release. There was a direct email sent out to GPMS users yesterday, and there'll be another one sent out on the 22nd of June. On the 29th of June, the updated system will be available, and we'll send an email to providers advising them that the release has occurred and with information of where to find GPMS resources. On the 29th of June, we will have all updated guidance material relating to portal enhancements published and accessible on the department's website. We've also included a QR code at the bottom right-hand side of this page that will take you directly to the resources page. Next slide, please. Now, this is where this is our usual slide where we let you know where you can find support. So the My Aged Care Service Provider Assessor hotline can be used for any technical support and general information for registered providers, assessors, and hospital staff who use My Aged Care Services support portals and the GPMS portal. You can also visit the health website for more information on the GPMS resource page, and then you can also come directly to the GPMS projects inbox, which is the email address is provided there if you have any general inquiries. And then you can call the Services Australia Aged Care Provider Inquiries line for help with the aged care claims and payments. And you can contact the Aged Care Commission for any questions relating to change in circumstances or the smart form. And that's it. Back to you, Faye.
Thanks, Shahara. Lots going on there too, isn't there? So you're becoming quite the regular here with us, and we're thrilled to have you join us again. So thanks very much. So next up, we've got Tony Burgess and Erica Barnett to talk all things updates for support at home in that space. And I'm sure you've got a lot to get through. So over to you guys.
Great. Thanks, Faye, and good afternoon to everyone online. I'm Toby Burgess, Acting Assistant Secretary of the Digital Strategy and Assurance Branch. In this update, I'll touch on the changes being made to personal care entitlements as part of the Support at Home program, which Faye referred to a little bit earlier. I'll then pass to my colleague Erica Barnett to talk about a change to prioritisation to include motor neurone disease. So what's changing? The core change is that personal care will move contribution category from independence to clinical supports. As a result, participants won't pay contributions for approved personal care delivered on or after 1st of October 2026, where funding is available. This will be visible in practice through changes to billing, invoices and participant statements, with personal care contribution amounts removed. Providers will need to ensure systems and processes reflect the new contribution treatment so that charging, claiming and reporting are consistent. Clear and consistent communication with participants is essential to explain what's changed and avoid confusion during the transition. As part of what's changing, we also want to cover off on what's not changing. So what is considered personal care remains the same. There are no changes to service scope or activities. The media release in particular did focus on showering, but it's the entire scope of personal care that moves. How personal care is delivered does not change. This includes workforce roles or care delivery models, and eligibility and improvement requirements remain unchanged, so participants must still be approved through their care plan. Service IDs and pricing structures remain the same, so this is a contribution category change only. And finally, provider responsibilities remain unchanged. This includes accurate claiming, billing and record keeping. The slide here looks at the change from both the provider and the participant perspective. So how it lands for older people will depend heavily on how providers explain it and support them through the transition. While the change is technical in design, it is personal in impact. Participants will notice changes to what they are charged and what appears on their statements. That makes clear, early and consistent communication from providers essential. So for providers, the change may require updates to ICT systems so that service setup, billing, claiming and reporting reflect the new contribution treatment. Claiming and payment arrangements will need to align to the new contribution settings, and care plans and service agreements may also need to be updated depending on how providers currently describe or apply those contribution arrangements. Communication with participants will need to clearly reflect the change. From a participant perspective, some people may wish to revisit their care plans if they previously opted to receive less personal care than they preferred or needed because of those contributions. Participants may also need to agree to updated service agreements and will begin receiving updated statements and invoices. In terms of personal care contribution change split up amongst the 4 boxes you see on your screen now, at a people level, this change affects how staff, care partners and participants understand and experience personal care. Frontline staff will need to confidently explain the change and support participants through it. Participants themselves will experience this most directly through what they are charged or no longer charged and may change how they use services. It's important to note there are no changes to workforce roles, qualifications, delivery models or registration categories. The personal care services can still be delivered by personal care workers. The service type is moving to clinical supports category for participant contributions only. There are also process impacts across care planning, billing, invoicing and service agreement management, which will be largely dependent on how an organisation operates. Providers will need to adjust processes to reflect that personal care no longer attracts a contribution from the 1st of October 2026. Importantly, this includes handling the transition period where pre- and post-October services are treated differently. Information and documentation needs to be updated to stay accurate and consistent. This includes service agreements, care plans, websites, internal training material and participant communications. Clear, consistent information will be critical to avoid confusion, especially for participants. Finally, there are technological impacts, particularly across provider systems. Billing, invoicing, client statements and reporting systems will all need to reflect the new contribution treatment. System configuration and data must also align so the change is applied consistently and accurately. So while the policy change itself is straightforward, delivering it successfully requires coordination across all 4 of these areas. You might have also seen in the media some other changes related to support at home. So I'll throw to my colleague Erica now to cover some recent changes to how we handle the prioritisation for funding for participants with motor neurone disease. Thanks, Erica.
Thanks, Toby. So this is our late inclusion for this presentation, but I'm really pleased to be able to share it with you today. So on the 3rd of June, Minister Butler announced that we are recognising motor neuron disease as a rapidly progressing condition for supported home prioritisation. So going forward, older people with MND will be given priority access to supported home funding so they can get their services sooner. The change took effect from the 6th of June 2026. And I can also share with you today that the majority of those people who were on the queue with an MND diagnosis registered had their funding released last night, overnight. There are a few people in the queue who haven't quite hit the urgent period yet, and they will have their places released in the coming week or so. So really pleased to get this one out. There's no action required from anyone who already had their MND diagnosis put in their assessment. If people have been diagnosed since they had their last assessment, they will have to go ahead and get a new one triggered so their assessor can have that registered and they can get that urgent priority going forward. So yeah, really quick change there and nothing much else to add. And so then I just wanted to talk about the other engagements we're doing for the personal care change. If we go to the next one. So we've got a lot of feedback through channels, engagements with vendors and providers that people would like to have the opportunity to do more sort of live Q&A with the department and have vendors and providers in sessions together to kind of bridge that communication gap. I know that the Services Australia sessions are really focused on your very technical resources, developers, that kind of thing. So we really needed to work on getting another channel set up, and we've had the time to do that now. So if, that first QR code there is going to take you to a page on health.gov.au with a bit of information on the change for providers, but also sign up links for fortnightly drop-in sessions. They're completely optional. Anyone can sign up. Next one's tomorrow. Just hop in, answer some questions. The department will answer some questions, and we also have get some guidance on planning out the change over the coming weeks. There's also some information on My Aged Care now. Participant information tends to go on that platform just because it's the most accessed channel for them. So you can share that link with them, and also just any of our newsletters. If you sign up, they're going to be your best point of contact for getting updates as this change goes through. Thanks, and thanks Toby for running us through the change.
Excellent. Thank you so much, Toby, Erica. So we know there's a lot of interest in support at home, and so all the information I'm sure has been very useful. And I think both Erica and maybe Toby will be around later on for any Q&A in the session. So now we're moving over to a learning bite. So I'll hand over to Emily, who's going to present it for you. Over to you.
Thanks, Faye. I do think we just quickly swept past the polls though, so we might skip back to that once I've done with the learning bite. But we will move on, we will continue. Hello everyone, I am Emily Simlat, as Faye just mentioned, and I'm here to present with you another learning bite. Previously in these sessions, we have explored how AI can support productivity through smarter ways of working, like refining prompts and managing security risks. But today I wanted to shift the focus and share some practical, trusted resources, because we know it can be difficult to navigate what's credible, current, and useful for real implementation. And I think it's important to also acknowledge the vibe in this space, that AI is massive. It's exciting, but it can also feel overwhelming, especially for those who are just starting to adopt it or make sense of how quickly it's evolving. There's no shortage of information, but it also makes it harder to know what to rely on. So whilst we're not AI experts, we can point you to the government-endorsed practical guidance designed for Australian organisations. So with that, on the 8th of May this year, the National AI Centre launched ai.gov.au, which is described as the new front door to help organisations use AI safely and responsibly. The reason we're highlighting this is that it's not just another blog or vendor page, but it's positioned as a trusted platform, bringing together practical guidance, tools, and resources from across government. It's designed to give businesses, not-for-profits, and other organisations a clearer place to start. And importantly, it's not only what is AI, it's about how to adopt it, understanding where it adds value, planning, supporting your workforce through change, managing risks, and good practice. So if you've been thinking we need to implement AI, but where do we begin? this source is built to answer that exact question. What we really like about this site is that it's organised around what organisations need to do. So policy, planning, safe practice and capability. Under the section for practical guides and learnings, you can jump straight to things like creating an AI policy, planning tools and templates, and planning tools and templates, which is often the first blocker when you're trying to operationalize AI. And it explicitly calls out essential practices for responsible AI. So you're building capability without creating new risk. And if your team is looking to lift capability first, the training section includes practical learning options like TAFE New South Wales micro skills, as well as real world case studies. For example, on screen here is a look into how not-for-profit organisations use AI to reduce admin and focus more on service delivery. The message today is we're not saying go and use AI everywhere. We're saying start with practical, responsible steps using trusted guidance, and this is a great place to start. That's all from me for today. Quick learning bite, and back to you, Faye.
Great. So are we skipping the polls? I'm not sure where we're at with that one, Emily.
I think we might go ahead and do it. So just before we jump into Q&A, we'll run a quick poll. Now, this is the first time we've done a poll in Tech Talk, so it's a bit of an experiment. We hope the tech holds out. Effectively, we're just wanting to touch base with our audience. We're always really keen to hear about the things that the sector wants to discuss, the information they need to do their job well. We want to make sure our agendas are hitting right and giving you all the detail you need. So that's what the poll is about, and it should be popping up on screen for you now. Hopefully everybody can see it. I know I can on my play along at home. So I'll give everybody 2 seconds. Again, trying to determine if you're finding the sessions valuable. We're interested in finding out what about them you like. We also want to know if there's topics that you want to cover that are more relevant or of interest to you. And we're keen to understand what motivates you to attend these sessions. So feel free to be specific about that. If you come to listen to a particular segment, or if there is a particular person that you always want to hear from, or a particular technology you want to talk about, we're keen to know what that is for you. And lastly, question number 5, it's nice and short, how we can make the sessions more valuable.
Excellent.
Great. All right. Well, hopefully that's given everybody a couple of minutes. The text held up well from my side, so I'm hoping
so far
that's
so
the
good.
case.
We've got a few responses, so thanks, people. I can see them coming up. There's like 38 so far. Take your time. We've got a moment. We actually are running a little bit ahead of time, and we're actually just moving into the Q&A. So we've got a bit more space than we normally do.
Yeah.
Excellent.
So we'll go ahead and we'll set up the panel. And in the meantime, if you want to spend a bit more time on the poll, you've got time to do that. Okay.
Great.
So let's go ahead and bring our panelists to stage. So we've got Erica, Toby, Shahara and Rex, and of course Faye. We'll take the slides down, looks like we have, so that we can see your face as well. As always, we're going to get through as many questions as we can. We've got a reasonable amount of time today, so I think we might, don't want to be too ambitious, but we might get through all of them. I'm going to start with one of our first questions that did have a few upvotes as well. And this one is from George Margellis. Hi, George. Great to have you back with us today. So the question from George is, with the release of the National Framework for Digital Health Standards by ADHA recently, how does that relate to the aged care transformation work? In particular, what are the plans around the use of FHIR and the local Sparked initiative? So I'm going to direct this question to Faye, but can you start by just explaining what FHIR and Sparked are for the uninitiated, Faye, just to highlight?
Well, so I might just go back and say first, the National Framework for Digital Health Standards That's designed to create a consistent, safe and interoperable digital health ecosystem in Australia. So the ADHA have put that out there and provides governance, coordination and guidance for all contributors, including government, healthcare providers, technology vendors, like everyone, around what our standards development and organisations should look like. The framework addresses the long-standing issue of some of the fragmentation around standards, which makes it very hard for us to automate and connect if we're not all talking the same language. And so that's where we can effectively work together. Now, the word FHIR was used. FHIR is the clinical standard, the information standard that's used as the information metadata or model that we're all going to use. Aged care reform used the FHIR standard in our APIs. I must admit though, the FHIR standard doesn't really cover all things aged care settings. And so we worked very closely to try and extend that FHIR information model. And the Sparked program is working with the CSIRO to help develop out that FHIR standard to make it an Australian national standard, because it is used globally. Include things that are specific to Australia, like our health identifiers. And I think we are looking to make sure that all the work we did in aged care around the extension for the care settings is also part of that standard. So hopefully that helps. We're all kind of working to the same sort of North Star. Thanks, Jeanette.
Great. Thanks, Faye. Thanks, George. Okay, our next question is from Lisa Northey, and the question is, will CHSP personal care services be exempt from charging client contributions also? Erica, is this a good question for you?
Yeah, so I don't work in the CHSP team, but I can let people know that the change for October is just for support at home. It is a good question though, so we'll take it up with my colleagues in CHSP. You might have seen in the media recently, there's been some audits and reviews into CHSP, so there is a lot of active work looking at the program. So yeah, I'm happy to take that back.
Great, thanks very much. Okay, the next question is from Bipin Hatara. I hope I've pronounced that correctly. I don't think I have, but anyway, that's my best go. And this one is for Rex. This is my first session, and I apologise if this has already been discussed. As an aged care provider, I'm still not clear on how B2G can practically help us or how I can be actively involved. Can you please provide some examples of how it can benefit us? So first of all, welcome, Bipin, and over to Rex to answer your question.
Hi, Bipin. Welcome and thanks for the question. So currently providers engage with the department in various ways, but up until recently, it's largely been confined to manual entry into departmental systems or extraction of data from departmental systems. So what the APIs enable is a way for that data to be transacted in a programmatic way so that it can be done from third-party software systems. So that could be a software system that you use in whichever provider or you're from, or a third-party provider that provides that service for you. So rather than going and retrieving client information from the My Aged Care portal, for example, the APIs would allow us to extract that data through a third-party system so that you could access it in your own software. I hope that makes sense.
And
Thanks,
they go both ways too, don't they, Rex?
Oh, sorry, go on.
So
no, I was just going to say they go both ways, right, Rex? So the client APIs allow them to pull data out of our systems, but the first API we put out there, which was the quality indicator one, was a way for them to do their regulatory reporting to us in an automated fashion as well. So rather than kind of entering all the data in their own system and then swivel chairing and doing it in ours a second time, if they get their software vendor to, you know, update, they can push a button on their system and it automatically reports across.
That's correct.
Yeah.
That's magic, Faye. I was just about to say, do you want to talk about the swivel chairing? Because
yeah, well, there you go. Read your mind.
Yep. Great. Okay, next question. So this one is from Alex Poz. And Shahara, I think this is a good question for you. Any specifics about what will be changing with the QFR? Which fields are being removed, added? Can you give us some details on that?
Yeah, sure thing. So the department's going to be releasing details on the specific changes, which are going to come through for quarter 1, which is the July to October period. But just at a high level, the changes are going to include 14 new expense data items. There's going to be removal of 6 existing data items in the labour hours work, the RN minutes section. And then there's going to be removal of break management expenses data items.
Great.
Great. So that's some great detail there. Okay, hopefully that answers your question, Alex. Stuart Smith asks for Erica or all, though slightly off topic. This MND change shows the system can take a clinical condition recorded at assessment and automatically act on it for prioritisation. The new restorative care pathway is the inverse problem. Capturing whether a participant's function improves over an episode. Is there equivalent intent to capture restorative care outcomes in a structured way at the system level, or does outcome measurement stay entirely within each provider's own records? Do you want to pick that one up, Erica?
Yeah, I can answer little bits of it. So I guess probably a few things to take on notice. So restorative care pathway for people who are joining supported home for the first time may be the first thing that they go on to, and then go through a support plan review with an assessor to go on to an ongoing package after. So there is a point there for capturing it, but I hear what you're getting at. It's more around that exit planning process from the multidisciplinary team and how those outcomes are recorded. Right now, that would be similar to a care plan and mostly on the provider side. In terms of immediate plans, there's nothing underway at the moment on the roadmap, but I think it's something that we could look at in future. And yeah, I'm happy to take that back as feedback.
Great, thanks so much, Erica. Okay, next one from Tracy Buckholtz. Hi, Tracy, nice to see you here again. With this functionality also, will this functionality also apply to supported home providers, particularly the responsible person's information? And Shahara, this question came up while you were speaking, so this will be one around the GPMS system.
Yep, sure thing. So this functionality is available to all registered providers who have access to GPMS and have the appropriate permissions, including those for the supported home cohort as well.
Great. Excellent. Okay. Steve Goodwin, who's also a regular at our forums. Hi, Steve. With the almost convergent activity with allied health in flight for 2030, is there an alignment between the roadmaps that can be considered? Also, given the success of the sector partners approach for aged care, are there learnings shared with the allied health team that could build on the work that has been done already? For many providers, this will potentially be a continuum rather than a separate set of changes. Faye, I might direct this one to you.
Thanks. Look, I've hit your link and I had a look. We could definitely go and find the team that's working on this. We are looking at opportunities to use the model further afield, including on how we might share the approach with potentially the TGA and other areas of change, including disability and so forth. So I'll take that one away and go and have a chat to different teams, especially where there's big volumes of change. But I would also encourage you guys to, when you're talking to other government counterparts, ask them to reach out and say, you know, they could leverage the channel that we've already created. I'm also happy to make it a multi-channel. So if there's, you know, if it's too much to go in one, we can always create like different series for different themes. But I think the benefit is bringing it all together so you can see the volume of change that are potentially, to your point, Steve, hitting single providers, even though it's being developed separately within government. So thank you for the question and we'll follow it up.
Yeah, thanks, Steve. It's great to hear that that channel's working for you. And just FYI, it works really great for us as well. So the idea of leveraging that for other programs sounds great. Okay, next we have Siobhan Tuttle, and the question is, can the department include CHSP content in future as well as part of the aged care updates? Okay, Faye, this is broadening the roadmap a little bit more.
Okay.
Sort of speaks to the same issue that Steve raised, so I'll let you take that one.
So to give me the question again, sorry, I was just reading a note that
Yep.
was being pinged to me in the background.
Can the department include CHSP content in future as well as part of the aged care updates?
Yes, we can. If there's any particular topics, we can absolutely include them. We can reach out to Toby and the team to tell us that what's coming up over the next 6 to 12 months in that space, and we can definitely bring more of that material here. So,
Thank you. We've
yeah,
heard
we're on
you,
that,
Siobhan.
right?
We'll get it on a future agenda for you. Okay,
Yeah.
sounds great. We have Fung Wright, who's asked, are there any updates on quality indicators in home? And I'm not sure who on the panel is in a position to answer that, if anyone, but we'll put it out there. Does anyone want to pick that one up?
I think we might just take that one on notice.
All right, we'll go ahead
We
and
wouldn't
take
want
that
to
one on
start
notice.
any accidental rumors, right? So, yeah.
No, we don't want to guess
No.
the answers. It's just if anybody knew. Yep. Okay. The same person has a question for Shahara as well. When will we see the associated provider list updated, as we submitted changes some months ago?
Yeah, sure thing. So due to the start of the Aged Care Act, the Commission received a large number of forms with updates to the associated provider information. And so unfortunately, this may have impacted response times. When you submitted your approved provider form updates, you would have received a reference number, and you can use that to follow up with the Commission. And the Commission is prioritising forms that are time sensitive. And, you know, I apologise, we really appreciate your patience, and we recognise that it's taken a bit of time. If you do need further assistance, you can contact the provider inquiry form on the Commission's website, or contact the Commission's customer contact team. I can give you guys the links to those forms and stuff on in this chat if you'd like. But like I said, you would have received that reference number as well when you submitted that information.
Great, thanks, Shahara. Okay, Alana Sills asks, does the department have a list of verified third-party providers for AI, i.e. that the data stays in Australia? Faye, I think I'll let you pick this one up as our departmental AI accountable officer.
Thanks for that. Look, no, we don't have an official list. There's quite a lot of content out there. You could go to I think it's the Department of Infrastructure or Industry. I've got to get that name. We'll put it in the chat for you. But they do provide a lot of AI information for the sector. We also have our Digital Transformation Agency that provides a lot of standards and guidelines. Look, within the department, we're currently using one particular tool. I think it's been in the media, so I can say it here, which is the Microsoft Copilot. That's definitely, they've made a commitment to say they've bought their service in country and to make sure the data is sovereign. But all publicly hosted AI, you need to be careful with anyway. So most of this is making sure that you have your own internal deployed version of it if you want to keep your data private and sovereign. So it's not just about being sovereign, but it's about keeping personal and identifiable data inside your company's network. So being sovereign is not enough, especially if you want to use it for internal organizational work, like putting a care plan in and so forth. So my suggestion would be go and speak to your local IT support, whether you've got that internally, or you may need to, actually seek some advice so that they can come and provide you a solution that is suitable. So go and, hire someone to provide some of that information. Because it really comes down to how you implement it within your own organization, and using the publicly hosted version of any of the AIs will not meet the minimum standard that you need to make sure that you're keeping the data privately hosted. Hopefully that helps.
Thanks,
Seek help is probably the answer.
There's a lot out there, and that that site that that Emily shared in the Learning Byte is also a really great new resource. So that's a good location to go as well. Okay, next question is from Jane McDonald. Will CHSP transition to support at home? What's the plan, and will there be transition funding for providers to access modern systems needed to drive efficiency and support financial sustainability? Is that a good question for you, Erica?
I'm happy to answer that one. So a few parts to this one. The overarching one, will CHSP transition to support at home? For those of you who watch Senate estimates, if you're interested in that kind of thing, or have seen our recent inquiries and things like that, you would know that there is a lot of interest in this. At the moment, the position is that CHSP will transition into support at home no earlier than July 2027. I do appreciate that we are now getting closer to that date and there's a lot of interest in what's going on, but there's nothing else to share at the moment. In terms of the overarching question about whether funding will be provided to the sector to help with ICT changes, that will ultimately be a decision to be taken by government, informed by the department and advice from industry at the time. We did do small grants for ICT support for support at home, fully acknowledge that they were quite modest, and we have received feedback on that. We have a lot of lessons learned from implementing support at home. We've got providers that were operating under the home care packages program that have still taken some time to get on board with modernising their systems, or have been working really closely with their vendors to complete their solutions. I think you're absolutely right. We do need modern systems to support a program that is as dynamic as support at home, with people moving on and off short-term pathways, their contributions changing, that kind of thing. Also, we have a very different provider group for CHSP, with much broader group of smaller providers, maybe offering just one service like gardening or meals and things like that. So we definitely have some work to do with the sector on how we transition, and we're certainly feeding all of that into our transition planning and thought processes.
Thanks very much. That was a really comprehensive answer, Erica. And while I have you, I'll hit you up again. So we have Pratibha Iyer, who's asking, can you speak to what work is being done for the department to be able to access claim data from SA Services Australia, I'm guessing, to avoid the burden falling onto providers to provide additional reporting data?
I would probably have to ask for a more specific situation in which this has been required to answer. So we might have to take it offline. Where we are legally able to do so, we do share information across departments. So I think, yeah, we'd probably have to find out that specific use case on why you are being asked to provide that data. Sorry, that's not a very clear answer, but we do share information across departments where we're legally able to do so.
All right, we might be able to get a little bit more detail as well and come back to Erica. Thank you for that one. Jane Floyd asks, how is the GPMS supporting registration and managing of large numbers of associated providers, and what is the plan to reduce this highly administrative activity, especially in terms of notification of change forms being individual? So this is one for you, Shahara. I know it has a link to the commission, but I'll let you, you get started.
Sure thing. So the department and the commission are working quite closely to strengthen data collections and storage processes, including strategies for leveraging data in future submissions. So we are aiming to improve GPMS usability and assist providers in meeting their mandatory reporting obligation. So we will come back to you to inform you of any updates that we have in supporting and creating efficiencies in this space as they become available.
Great. Thanks very much, Shahara. We have a question from Darcy Stewart. Will the list of software for aged care claiming be updated anytime soon? The last update was in January and currently has errors in the support at home column. I'm not actually sure who owns that list of software for aged care claiming. We'll have to do some research on that, but does any of our panelists have any detail on that one?
It is a Services Australia managed list, and we don't have Services Australia on the panel today, but I'm happy to raise it with them in our regular engagements with the support at home team over there.
Great. Thanks, Erica. That's a good one. Okay, and it's looking like getting down to our last questions. This one is from Emma Walsh. How is the department working collaboratively with providers and vendors in navigating the ICT updates needed for the 1 October personal care changes and then generally for the ongoing transition issues? So Erica, you spoke to this a little bit in your presentation today. I'll let you recap some of that info.
Yeah, for sure. So we've got the quarterly software engagement that happened through Services Australia fairly recently, but we have also triggered the fortnightly new sessions that the department is running in partnership with Services Australia, where people can register to come and submit questions and talk with us about, I guess, the planning through to October to implement the change. So I think in the link there that got put in the chat, there's links to the page on health.gov.au that runs through the personal care change, and there's all the sign up links for the fortnightly sessions. For those of you who aren't aware as well, we do still run a sector working group that we've been running since 2024 with a representative group of providers, Ageing Australia, OPAN, COTA, and other representative peaks on support at home. We've done a few deep dive sessions with them looking into how this might impact how it might impact providers' business processes, their systems, that kind of thing. So there are lots of activities underway now that we have the capacity to do some more direct engagement, and we have those announcements after budget. So I would sign up to those drop-in sessions if the format works and we get a lot of success through that. For the personal care change, we will be looking to continue that for the end of life changes that will be coming in early 2027, where we're going to be issuing a second unit of end of life care. So yeah, welcome any feedback on the drop-in sessions, and please sign up and come along.
Great. All right. Well, guys, I think we've answered all today's questions. I'll do one last refresh of the panel board and make sure there's nothing there. No, all good. Job done. Excellent. It's been a while since we've been able to get through all of the questions in one session and also finish early, and maybe never is when that's happened before. So big thank you to all of our presenters today. Thank you for our panelists. Really great to have you here as always, Shahara, Erica, Toby, Rex, and also Annette. We know you're in the background with your audio but no video. Appreciate you coming in. We look forward to seeing you with further updates on your programs of work. But for now, we'll say thank you and goodbye. I'm going to hand back over to Faye, who's going to give us a little bit of an update from the spot poll that we took, just to give you a sense of the themes that are coming out of that feedback. Before I jump off stage, I will just remind you that our next webinar is coming up on the 15th of July. Registrations are open, so you can register with the QR code that will be on screen soon, or the link is in your chat. Finally, big thank you for bringing all your questions today and for coming along. Great to see you here as always. And Faye, over to you to take us out.
Thank you. And I just thought I might give you a little bit of the early poll. And if I just ask some of the results. So in general, you are finding these sessions really valuable. So thank you. You feel that the topics are quite relevant that we've been providing to you, and that you love being kept up to date on all the changes and the progress. So that's fantastic. Of course, all your detail we've got, so we'll be able to look to, pick out some of the information you've given us to help inform future tech talks. You also did say you would like to hear more on topics such as CHSP and the connection to allied health. So we will start to focus on some of those as we move forward. So that's kind of just a little bit of a quick recap of the results so far. So with that said, big thank you. Thanks everyone for coming along today. We have received some great feedback, and we really appreciate the time for you guys to connect with us. We will do a much more in-depth playback later. We'll bring it back to you. And you are finding, and so we appreciate that, and thank you, and we'll see you next time. Bye for now.